Welcome to How to Obtain Your Choice of Surgery Residency by Dr. Tan and Dr. Shah. This project represents a culmination of our experiences and reflections, both previously as applicants and now as members of the selection committee. Here, we will cover the fundamentals of how to successfully obtain your match of choice. First, and most importantly, you should think about your personal goals to determine what kind of residency you are looking for. You should reflect on personal values and priorities, and be honest with what is acceptable to you. One way is to create a list of personal values as well as of professional goals, ranking each. Then, integrate the two lists. See what conflicts will arise through this process and consider how you will manage them. Depending on your specific situation and priorities, certain residencies may be more conducive to accomplishing a particular personal or a particular professional goal, and this must be considered. To obtain your match of choice at a strong residency program, a lot of preparation is required. This preparation starts on day one of medical school and continues throughout. Generally speaking, a strong application includes the following: strong academics, including solid USMLE Step 1 and Step 2 scores. Higher scores are more desirable and even necessary for more competitive programs. Of course, attending medical school at a program with a history of an educational and well-organized, student-oriented surgical clerkship, as well as that for a sub-internship during your fourth year of medical school, are also very important. Secondly, you should find mentors at your home institution or from research time at another institution early on in the process. Declare an interest to your mentor as soon as you are seriously considering a career in surgery or in a particular surgical subspecialty. If you think you may have particular surgical subspecialty interests, it is additionally helpful to find a particular faculty member in the subspecialty that you are considering. This way, your mentor will be able to provide more tailored career goals and maybe even create research opportunities that are more suited to your own interests. Even if you did not have a dedicated research experience, make every effort to author or co-author as many peer-reviewed publications as you can during your time in medical school. If you did take time for a dedicated research experience during medical school, publications are essential. The quantity of publications on your CV will often serve as a surrogate of your productivity. Even a few case reports or a review paper will help your CV significantly, and the more you do, the more productive you will become. Spend some time both writing your personal statement as well as having others critically review it. Try to make the statement interesting, but certainly not arrogant. This is one area that you can truly differentiate yourself from other applicants. It is also a great place to show that you are truly passionate about general surgery or the specific subspecialty to which you are applying. Be sure to obtain letters of recommendation from people who you know both on a personal and professional level. Many students ask about who they should obtain letters of recommendation from. Certainly include faculty who know you well and who can speak highly of you. Even if obtained from a more junior faculty member, a good letter will carry a lot of weight. Having a letter from a big name can't hurt either, but if he or she does not know you well, it won't necessarily help you either. Be sure to ask your mentor's opinion about this. Have a good picture taken by a professional photographer. Check your application for typographical errors, then have someone else check it over for you, and then check it again. Always keep a professional, updated CV using the standard format. You might be able to obtain an example of the standard format from one of your mentors, or you can download a template from the AAMC website at the link shown here. Have your mentor, program director, or dean advise you on the content and formatting of your CV. Again, make sure to proofread it thoroughly. The number of interviews you ultimately will complete depends both on your own personal preferences as well as the strength of your application. If you have a very strong application, you may not need to interview at all the lower tier programs. Regardless of the strength of your application, however, always have a backup plan, including a few places that serve as second choice programs. Interviews can be expensive. Some students take out a small loan to help offset expenses incurred during interviews for residency. Some banks will offer good rates for physicians, so be sure to ask around. In order to prepare yourself for the interview, search the internet for program and faculty information, especially strengths of the program and how their vision and mission will align with your own personal career goals. Look up the publication list of faculty members to understand their research interests and their research commitment. Certain research programs or research opportunities provided by particular residency programs may be highlighted on that particular program's website. Have answers prepared for certain common interview questions. A few examples include, why have you chosen to pursue a career in surgery? Why are you interested in coming to interview at this particular program? Why do you think you'll make a good fit at this program? It is also advisable to have a clinical case or two that is memorable to you prepared to present. If you show passion as you discuss the case, it can demonstrate your excitement for the field. Prepare to discuss your research and be able to defend your data and your findings. You may need to explain your research to someone who is not familiar with your research topic, someone who knows considerably more about it than you do, or someone who has a completely different opinion on the subject than you or your research mentor. You should be prepared to present your research in each of these contexts. Finally, you should review your career goals and have realistic expectations. These may change over time, but you should be able to support your current ideals. During the interview, be on time and be energetic. Remember, the interview is only for a few hours, so be energetic during that time. Smile and greet people. Be interesting, be passionate, and speak slowly and clearly. Have a plan for how you will execute research during residency, especially if research is a required part of your training. If research isn't built in, still have a clinical project you find interesting and may want to pursue during your time as a resident. Have realistic goals for your career and don't be afraid to discuss them during the interview. Do not appear arrogant. Remember, the faculty want to teach you. You also want to portray yourself as a hard worker, so don't ask about time off or vacation early on in the interview, and don't ask at all unless absolutely necessary. Finally, you should dress appropriately. Don't wear heavy cologne or heavy perfume, and keep makeup reasonable. Suits should be well-fitting and not flashy. Programs are looking for someone with the following characteristics: someone who is trustworthy, dependable, hardworking, enthusiastic, a team player, and someone who will be academically productive. Residents and attendings work very closely together. Faculty want to find someone who they will get along with, someone who they can trust with their patients. In turn, faculty enjoy teaching and training you. After the interview, promptly send thank you notes. Be careful with typographical errors. Sending thank you notes via email is absolutely acceptable, and they are often received faster than mail. A nice thing to include is a topic you discussed during the interview that was unique to that particular conversation. Write down the pros and cons of each program immediately after you visit them, perhaps at the hotel or on the plane on the way home. After completing your interviews, talk with your mentors about the programs that you interviewed at and developing your rank list. Don't be afraid to ask your mentor to make a phone call to your top institution. A phone call, especially from someone in the specialty, carries substantially more weight than a letter. When generating your rank list, do not rank programs only by prestige. Certain programs simply might not be a good fit for you. Other things to consider in this process include, what are your career goals and your research goals? How can each program on your rank list help you to achieve them? Consider the needs and wants of your family members, spouse, and/or significant other. Be honest with yourself and remember that residency is typically 5 to 7 years. Depending on your independent circumstance, geography may be an important factor to weigh in. Trust your own gut feelings about programs, but nonetheless discuss your rank list with your mentor, your general surgery program director, and/or your dean, as he or she may have additional insight into the programs that you're ranking. If you don't match, keep your chin up and be persistent. The APDS website may have information about programs that went unfulfilled or about other opportunities outside of the match. Be sure to ask your program director or dean about similar opportunities. Discuss your application for a preliminary year with your program director or dean. Perhaps even consider pursuing a residency in a different specialty. Spend time in research or in other ways to improve your application. If you are embarking on a preliminary year, study and score well on the ABSITE exam. Work tirelessly to impress your senior residents and faculty during your preliminary year. In conclusion, just as you are looking to find a program that fits your own personal goals and objectives, programs are looking for the right resident for their program. Listen to advice from your mentors, general surgery program director, and your dean, as they have been on both sides of the process. Be honest with yourself about your own personal and professional goals and what it will take to achieve them. And finally, be happy with your choice. Of course, if it's not right for you, you can always change your mind. We hope that you found this presentation to be useful, and best of luck in the process.